Pulmonary is the study of the lung and all things associated with it. My name is Dr. Jorge Cedano with Salina Regional Pulmonary and Critical Care Medicine.
Well, Dr. Cedano, thank you so much for joining me today, and welcome to Salina. Why don't you start out telling the viewers a little bit about yourself and also what all pulmonology entails?
Thank you for having me, Mike. I've been here 2 months in Salina. It's been great. I came from Kansas City. I did my training there in University of Kansas. Before that, I was in New Jersey. During the COVID-19 pandemic, I did my residency there. Pulmonology entails is the doctor that sees people with asthma, COPD, or sometimes we know as emphysema. We also see people with shortness of breath, and we try to look what's going on, why they're having this shortness of breath. We also see pulmonary hypertension. We can also see one of them more I'm passionate about is pulmonary nodules and lung cancer screening programs and diagnosis.
Okay. I also know you see some patients as a critical care physician in the ICU and whatnot. Why don't you talk about that?
So yeah, ICU is a little bit different from the pulmonary part. It's what we call more acute, meaning that these patients are sicker. So we usually take care of the sickest patients in the hospital. And what that entails also is people that require life support. So when they're connected to a mechanical ventilator, when they have blood pressure medications to keep the blood pressure up. And also we do a rate of procedures, like for example, central lines, we do chest tubes, we do intubations. And we also mostly coordinate treatment with dietitians, nurses, case managers, so we can stabilize patients, keep them healthy, while they get better, and then we can get them out of the ICU so they can continue their lives.
Okay, I know you mentioned pulmonary nodules. Why don't you explain what those are and what you do for them?
So a little bit about pulmonary nodules is that usually the medical definition is when there is a spot in your lung that is less than 3 centimeters. When it's more than 3 centimeters, it's called a pulmonary mass. So when I try to talk to patients about this, I try to put them both together, pulmonary nodules and pulmonary masses, because there is a lot of things that can cause these things in the lung. For example, it could be infections, it could be granulomas, which is a type of inflammation, or it could be scar tissue or fibrosis. And the one that we're more scared about is lung cancer. The important thing about these things is that we need to see every patient and individualize them and see what risk factors they have, and if they qualify for any kind of treatment for these pulmonary nodules. Not everybody that has a pulmonary nodule has cancer, so we need to determine who needs extra procedures, for example, biopsies or follow-up imaging, or sometimes we can send it to the surgeon and get the lung nodule out.
Well, doctor, thank you so much for coming on the show, and thank you for watching. For more information, please visit salinaregionalpulmonology.com and like Salina Regional on Facebook. Follow us on Twitter and Instagram.